Continue the research. When was that? 20th of January 2006, the magic date. Until now the research is still. Please take into consideration. I know you are a very intelligent boy. I am calling boy, is only 29 years old. I can almost be his grandfather. Okay. So, what do you think I would have done? I knew it was difficult. So, I was waiting, I was pushing, and they were just delaying, dilly-dallying, nothing. So, what did I do next? No, that's not that. Go. Okay. I begin to get more and more dengue patients. So what we did, we started documenting all cases which came to our center and gave us enough information about their platelets, blood report and their health. Go back to the list. Go back. Okay. See the list. How many you need for a proper clinical trial? What is the number? N, how much? Even 10 is acceptable. Do you know? How many here? This is what we have documented. Undocumented, double this. Now all these people's case reports are in our center. And all of them recovered within 24 to 72 hours. So now you want evidence? Evidence. You want the people's names? People's. You want the blood report? You have the blood. So what happened? More and more and more and more people were treated and treated and treated. Today I can call Dr. Aguilar, how many cases you have treated? So many. Padma, how many cases you have treated? So many. And there are so many people here who are in my group who have treated dengue. That DJ's case was just one case of dengue hemorrhagic fever which I wanted to. He would have died. Today he is playing football in his school. Okay. So, the next one we did was MSU students who were doing their research projects, they approached us to do, and I told them to do on dengue. So the thing was done. What? Go to that. Okay. No. The Management Science University. The paper was completed at the end of 2007. The student got a distinction for the research project which proved the effectiveness of natural remedy for dengue fever. The copy of that is included in this document. You can read that. Endorsed by their own professors in the university, and she got it. So with the passage of time, more and more patients afflicted by dengue and malaria fever was treated successfully. These results added greater truth, correct, to the healing power of the formula. Okay, that was 2007. Then, next, we presented to University Science Malaysia. Very interesting story. We met, the doctors came, I said okay, they all gathered, we presented, pathologists, doctors and all that. At the end, you know what they told me? We pathologists, we have only technical power. We don't have administrative power. We cannot make a decision. So I said, so you can't? No. We have to write to the Ministry of Health, Ministry of Education, get special permission, special funds, all kinds of protocols, red tapes, we can't do. While having coffee, one of the pathologists told me this story. This is to make you feel relaxed. Nothing to do with dengue. I said, how's your research and all that? So he was sharing with me the research of, periwinkle? The one used for cancer. You know who did the funding for that study? Magna, Dr. Farid Arifin. So he told University Science to do a research extract the periwinkle's active substance and start from rats to guinea pigs to cats, even dogs, then monkeys, then people, then general population. So they did on rats, guinea pigs. He was telling the story to me. You are going to laugh. Then he said the cats, dogs, and then monkeys. Finally, they had problem with the monkeys. The monkeys, they couldn't get enough monkeys. I said, why? Somehow the monkey knew we are going to do tests. They ran away in hidden places they couldn't find. True, you go and ask. I can give you the name. You know how many million was spent on that? 10 million. Periwinkle study for cancer. Because Farid Arfin's son had cancer, he got excited. So he did all this Magna thing and all that. I'm a good friend of him. I met him many, many times. He was student leader during my days in USM. Dr. Farid Arfin. So finally, the monkeys union probably met and said, we don't cooperate. The whole project went into the tree. You tell me, 10 million, Western model, 10 million, down the drain. You give me 10 million, I think I can solve the dengue problem in Malaysia. These are first-hand information, I'm hearing from pathologists. And did it come out in the papers? The periwinkle project was aborted because the monkeys union didn't want to cooperate. Today, I am begging for an audience to present, and they are just don't know what to tell. Today we are going to declare. Later on, I'm going to, in front of whoever press is here, I'm going to say with a letter, we have the cure. Anybody want to take action? I got 5 lawyers here. 5 lawyers. And you will see one lawyer singing songs later. My good friend, you are going to enjoy his songs. We were schoolmates. Because if after declaration comes out whatever paper and the authorities are not happy, I want them to go to court, make the court make a decision. I'll bring all the dengue flus who are cured to the court until there is no place in the court. Why can't you just study? Why? What is holding you back? Hey, this is the chance to put AK, fix him up, do a study and say wrong. Don't want to do. Do a study and say I'm right. Don't want to do. Now, what do you want me to do now? I only can pray to God, give me the patience. But today more than thousands of patients have been treated. And it is increasing. Every other day we get calls, we send them to the home, to the hospital. Some the doctors know, they look, they laugh, they keep quiet. Some they don't know, some they say don't bring. But within 72 hours the patient is gone. To home, gone home, not gone up, gone home. Okay, next what we do. 2 Philippine cases. You saw that, huh? Padma's presentation. Philippines. Next. University Science, okay, that's we already spoken. Now, this is the product. Manna, 36 seeds. Proprietary blending. No extraction. Composite product. Unchanged from nature. We don't believe in extracting. We don't try to be smarter than nature. Nature put it in composite way, we leave it like that. But we take 36 seeds. That's Manna Plus. Then we have Samalu, which has got 8 or 9 spices. And one more, last one, cholesterol. These 3 goes inside and makes the body so powerful and different that the virus has lost its path. Because all this went and blocked, the virus don't know how to act. The immune system says, good, the virus is already, fixed. We move. We heal. What's the cost? What's the cost? $135. If you go to Pantai Medical Center with dengue fever, what's the bill you pay? 10,000 ringgit. That's minimum. If you go into complications, 100,000. You may have to sell your house. You are willing to spend 100,000 when 135 can do the job. Then we wrote to the Ministry of Health. We want to advertise the product. And this one, please take note. Ministry of Health saw all the papers. They took time. Waited. A letter came. We are unable to make a decision on this. And the letter is still available. When was that? When was that? Huh? 2009. 2009, 2010, 2011, still they are unable to make a decision. What a Ministry of Health did. Either you say, come, call, do research, see whether it's right or wrong. No one. Cannot advertise, cannot make a decision, the letter is hanging. You want to see the copy of the letter? We have. It is here in this document. Copy of the letter, we cannot make a decision. Cannot make a decision means you have to advertise. How? I want to ask, why? Maybe they don't have enough. Okay, next. That's what we want to advertise. Call us now. Goodbye to dengue. Cannot advertise there in papers. But we advertise backdoor. I know, give to everybody, everywhere, and all that. Same also, but not as good as. Okay, next. Now, this is a declaration today we are going to do. This is the final. In this document, the last paper is that. Okay? This declaration, we are making it official today in front of Dr. Saifuddin, we want to make, and all the others, and the press, whoever here. That we have a cure for dengue, and the documents are here, and the patient primary documents are at our center, and whoever feels after reading this that there's something not right, they can come and challenge. After ceremoniously, I'm going to pass over to the young hero there. Please pass it to Dato. I hope Dato will have the guts. Ini benda teruk ni macam mana kita? You take this, send to the Ministry of Health, send to the university, send to whoever you want to send to CDC America, send to World Health Organization. We are ready to face any one of them. And what is the implication of this declaration? Apa implikasi? The first implication, Malaysia will be the country which has developed natural remedy for dengue fever, which the world has not have a medicine. Itu orang politik ni jaga. Terbilang kononnya gemilang, lagi satu apa? Cemerlang. Wah, Prime Minister, he has gone. Oh, cemerlang kan? Ini pun tak boleh buat. Gemilang. Ada gemilang, tak mau pakai. Lagi apa? Bukan, merah, ada. Gemilang, terbilang, cemerlang. Terbilang, people are going to say, hey, Malaysia got up. Then come and do the test. You have lost an opportunity. Malaysia, if they don't, lost an opportunity. And I got my Sri Lanka friend here. Atma, can you stand up? They say the prophet is not welcome at home. So I told Atma, let Sri Lanka do it. Are you going to do, Atma? Yeah. See? So, Malaysia punya nama habis. Kau tamu, kau punya pasar. Sri Lanka, you do it. The land where Bodhidharma came from. So after this press conference, we are going to make it clear. This is going to give, and we have Dr. Agilan, Dr. Padma, Dr. Para, Dr. Raju, and who else? Dr. Lai. They are going to endorse this together with me, and we are going to pass it to him, and he is going to take to Dato' Safruddin. Kalau Dato' Safruddin tidak ambil tindakan, dia kena jawab kepada Tuhan Allah. It is an act of omission. Not commission, omission. You omitted to do the necessary work. I am brave. I am confident. Truth will back me up. So please, not for my fame. You see that last sentence? This declaration is done in the greater interest of human health and not for any personal or monetary gains. I don't want any money. What for? I'm old already. Some more what money? But young people's life can be saved. So that's a declaration. And the highlight of this conference is this declaration. If they don't accept, terpulang kepada dia. Mereka akan jawab di akhirat. Okay? Sorry for being very strong. Because last time tak ada ammunition. Orang cakap, sekarang ada ammunition. This is the book. So I hope after this, we will have the pleasure of giving to you, even though you are a young boy, you take care of Malaysia's future. Orang lain semua sudah dapat duit, jangan jalan. You baru muda ya. Ambil ini, buat sesuatu. Demi kebaikan Malaysia. Okay? Thank you very much, ladies.